Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Prather Chiropractic Services in Lafayette, Louisiana. Today we have Mr. John Daigle with us, who's a paramedic, longtime paramedic, been working for years, I guess in and out of an ambulance, lifting up on patients, a lot of awkward positions. And what we want to do a video on Mr. John because he has a unique case. Something he's had for a long time is called a spondylolisthesis, okay? A spondylolisthesis is when the anterior elements of a vertebra are separated from the posterior elements, and the parts of that vertebra can slide forward and create a bad alignment between the vertebral body and the disc. So Megan, if you can zoom in on Mr. John's x-rays, what we see here between the L5 vertebra and the sacrum is a degenerative spondylolisthesis that we probably categorize as a grade 1, where we have about 3 millimeters of slippage. This part of the vertebra, the vertebral body, has slid forward on its disc. And as a result, there's been bad joint motion between vertebral body and disc for years. And that has caused the disc to degenerate. One of the main characteristics of disc degeneration is dehydration. Due to lack of proper joint motion, you don't get this natural flow of fluid into and out of the disc, and that causes the disc to break down. This is also called degenerative disc disease, degenerative joint disease, all the same thing. Bad joint motion causes nerve pressure, leads to pain. So you came in today, you've had chiropractic care in the past,
Yes.
It's helped you in the past, but it is not helping anymore with what you've been doing.
Anymore.
Okay, your pain today on a scale of 0 to 10, where are we?
I'm looking at about an 8.
Okay,
Right now.
so that's pretty severe. And the pain has gone down the legs in the past.
Has
Okay.
gone down the leg, so
Okay.
left leg mainly.
All right, so you came in to us saying you feel like you need to be decompressed. There's pressure in your back that
Right.
needs to be released and it's not getting done.
Right,
Okay.
absolutely. It
All
feels
right.
like I need to be pulled
All right.
and stretched.
Right, and that's the thing. Our joints are, all of our joints in our body are subjected to what we call compressive stress on the y-axis. Because we're upright creatures, we stand, and gravity's squishing us down. So all of our joints can get compressed this way, and that can cause the lack of height, the loss of height in the disc that you see here. But in Mr. John's case, he also has what we refer to as a base posterior sacrum, where the sacrum has translated backwards, posterior on the z-axis. So our primary direction of correction, this is what unique to the chiropractic we do here. We're not interested in twisting or rotating these discs. We want to take his sacrum and shove it forward on the z-axis, and then we're going to decompress it on the y-axis with the ring dinger procedure. All right, straight orthopedics, very straightforward. Everything's in line with the normal anatomy, and we're going to see if we can get you some good results with these new
Sounds
techniques. Okay, any questions for me before we get started?
No, not
All right, just
Not
jump
really.
in, huh? Okay.
just waiting for that ring ding.
All right.
Just don't pull my head
Well,
off. It's
yeah.
not screwed on too tight. so-
That's right. Well, you ain't got to wait too much longer. But yeah, that's what we got to work on primarily is that sacrum and that L5S1 disc. Okay. So we're going to get you started right here on this table. We're going to go face down. There we go. All right. Now we're going to check your. So you're a little short on the right, like we knew. Okay. Let's go ahead and bend the knees. Do you feel that in the lower back when we do that?
Yes.
Okay. Now, Mr. John's very active as a paramedic. He also does Krav Maga martial arts. So he's got good flexibility. He is working out on a regular basis. That's important. We encourage all of our patients to do that. But at some point in time, even with exercise and activity, joints stop working right. So that's where chiropractic care comes in. So we're going to start with the sacrum, move to the pelvis, and then work our way up your spine, okay? You're going to feel this part of the table jump up. Okay, now we're getting very specifically on this S1, S2 tubercle of the sacrum. Getting a good contact with my hand here, and we're going to thrust P to A on the Z axis here. Okay, good. Pushing that bone forward. I'm not on the L5. We don't want to push the L5 any more forward than it is. We're on the sacrum. good. So now we're gonna jump above that L5 and move to the L4. Oh, good release there. That moved.
About that one.
Yeah, that moved very well. Okay, good. Okay, good. Now, let's bend the knees, be evened up. What's that feel like in the lower back?
It feels a lot better now than
Alright.
before.
Pressure release, right?
Yes. Big time.
There we go. All righty, sir. Go ahead and roll over to your back for me. Okay, that's it. Just leave your hands on your stomach, okay? Let's go ahead and extend those legs there. Feel the headpiece kick up. Let's put those arms in a T, just like so. Okay, hands on the tummy. Good. You got really good flexibility in your lower extremities. And I think that's helped you along the way not have more problems with that spondylo than you already have, because it can get a lot worse too. Let's spin you to the right.
This way.
So I always tell patients flexibility is the number one thing you can do. Stretching is the number one thing you can do to support your adjustment. Everything's about improving joint motion. So stretching really helps towards that. Doing stuff like beginner's yoga or any of your old high school calisthenics, stretching before sports.
Right.
Continue to do those things and make them a daily routine. Loosen that elbow. Good. Now we're adjusting everything to create a stronger neurological effect
Okay.
that's global, okay? Everything is connected. We definitely want to work on that joint, but we want to work on the entirety of the body as well. Okay, good. Loosen that arm. All righty, sir. Okay, so far so good. Go ahead and
So far,
stand
so
up,
good.
walk that around a little bit. What's the low back feeling like?
Feeling good.
Yeah. All right.
Feel a little more loose.
All right. Okay.
All right.
Decompression time, sir. All right. Let's go ahead and slide you down. That's it. We're gonna dead leg here. Let the table elevate. So Mr. John's been seeing some videos of these adjustments. And like I said, it made sense with your instincts, right? Knowing what you have going on in your lower back and understanding the logic behind this adjustment, it makes perfect sense to do. All right.
Pretty intense.
Yeah. So we're gonna stabilize that pelvis there.
And just
Tight
remember-
squeeze.
Yeah.
Yeah? You had a big breakfast this morning?
No, not really.
No? Okay. So you just want to breathe naturally through the nose, okay? Let your body really relax and just let this pin settle into the side. It's gonna be tight, and it's supposed to be. There you go. See if we can make those more jumpy.
All right.
All right,
I just remember my hair's not screwed on tight, so
Mine either.
don't pull it off.
All right, so let your body just settle. Just, that's it, just like that. No tension anywhere. Very, very relaxed. Keep your back teeth touching, tongue in the center of your palate so you don't bite it. Breathe naturally through your nose. Okay. Take that slack out and wiggle your third toe. Breathe. Don't forget to breathe. Don't forget to breathe. Now you should have felt that go
I felt that.
to the belt.
I did. It went all the way down.
Yeah, all the way. So that's that natural release we got on that y-axis. That's never been done to that L5 disc before. It's never been released in that fashion. But we got it today.
Oh, yeah, that was intense.
All right, good. Loose, loose. Okay, good movement there. Loose, loose. Okay, good release there. All right. First ring dinger done.
First one. Wasn't bad at all.
Wasn't bad. Wasn't bad. See there?
Not
Go
at
ahead and
all.
walk that around for me.
Not bad.
All right, give me a before and after. You should, other than sore and better, what do you feel?
Feel a little more loose,
Yeah.
like more
Right.
flexible.
Right,
When you did the ring dinger, I did feel it go all the way down to the belt area.
right,
And now it's just, you know,
Right.
have a
So-
little more
right. So as we,
flexibility,
yeah.
it seems like.
yeah, we keep introducing that vector of release into that joint,
Right.
gets the joint moving. We're unjamming it. So when you follow up and do either inversion at home or stretching, that movement that we're putting back in that joint is going to let that disc try to rehydrate itself again. That's going to bring you even more long-term lasting relief and hopefully stop that degenerative process from progressing.
Yes.
Because we know what happens after this, right? You're going to go to a neurosurgeon and he's just going to fuse it. That's what they're going to do.
Correct.
Right, and that's a coin flip, okay? That is a coin flip. With every fusion though, the degeneration above and below the fusion starts to accelerate. Because that joint is no longer moving, the fused one will no longer be moving. So the bones above and the bones below have to move double or more in order to make up for that lost range of motion. So if we can hold that off, it'd be great, okay?
I hope so.
All right, so you feel better?
I feel a lot better.
All right, good,
I would
good.
say about maybe 75% better.
Already, after one
Yeah,
adjustment.
just that one
That's pretty good.
adjustment.
Okay, so we're gonna repeat that 3 or 4 times and get you up and running. Any questions for me? We ice after if we're sore, ice and stretch like we
And I
talked
should
about.
be able to go back to work tomorrow.
Oh, yeah.
It shouldn't be a
Yeah,
problem.
no,
Okay.
I don't see any problem with that whatsoever. Now, if you are gonna be on the road driving a lot, I encourage you to keep your lumbar, if you have lumbar support in your chair, keep it maxed out.
They do.
If you have just another pillow that you can put back there and give your body some support here, keep
Right.
that pushed forward. That would also help to hold your adjustment in place.
Okay.
Okay. All right, sir.
We'll try that then.
All right. If you like this material, please share it with your family and friends. We're trying to get the word out on what chiropractic can do for people here, and we'd appreciate you subscribe to the channel and hit the bell for notifications. This is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.